Menopause is a fact of life. It happens with all women. The changes in your bodies from menopause can manifest in many forms: depression, lack of clarity or energy, lack of sleep, mood swings, sweating and hot flashes, weight gain, and an overall decreased libido. Today, you are very likely here to find relief from one or more of these symptoms. You'll understand what may be causing your symptoms and what ultimately is the best path forward to resolving or mitigating unwanted issues. Determining the right treatment can be an overwhelming experience. It often requires clinical expertise to find the right balance to manage your symptoms. Hormone replacement therapy is quickly becoming one of the most widely used treatments. During this brief video, we'll explain hormones and their role in menopause, hormone replacement therapy, or HRT, bioidentical hormones, a superior path forward, the BHRT process, smart partners, a path for relief, and this is important, we'll make the complex easy to understand and show you how to take the appropriate actions. Let's start by identifying the hormones we're focusing on, what they do for your body, and the role they play in the various stages of menopause. As you approach perimenopause, usually in your late to mid-40s, your body changes the amount of hormones it's producing. The stages of menopause primarily cause imbalance in estrogens: estrone, estradiol, estriol, progesterone, and testosterone. Weight gain, lack of sleep, and moodiness are normally the first symptoms women experience as they enter perimenopause. This could be a direct result of a decreased production of progesterone. When progesterone drops, your body becomes estrogen dominant, slowing your metabolism and causing weight gain. It's a vicious spiral, and no doubt why you've probably heard other women say, "The first 5 pounds came on relatively slowly, but the second 5 came on faster. The third 5 pounds, even faster." Progesterone also plays a role in aiding relaxation and sleep. When you have sufficient levels of progesterone, you have a calm sense of being. You go to sleep easily, and you're less prone to mood swings. Depression and migraine headaches are other symptoms of progesterone imbalance. Migraines that happen around menstruation are usually attributable to low progesterone. So it's important to map or keep a diary of when you're having migraines so we can determine which hormone may be responsible. Lack of progesterone or fluctuating levels of progesterone may also cause menses or spotting at different times. Now, your body produces 3 estrogens: estrone, estradiol, and estriol. Estradiol is the most common estrogen produced during your childbearing years, and estriol is the main estrogen during pregnancy. Estrogen levels decline significantly in your perimenopausal years, and eventually, estrone is the only estrogen produced after menopause. A lack of these estrogens, specifically estradiol, causes hot flashes, night sweats, sleep disturbances, vaginal dryness, and bone density loss. Now, while testosterone is normally thought of as a male hormone, it plays an important role in women, too. Women produce a small amount of testosterone in their ovaries and adrenal glands. Imbalances in testosterone may cause decreased libido, fatigue, bone density loss, and loss of muscle tone. Pregnenolone is the mother hormone, the hormone your body uses to make all other hormones. Your body starts with cholesterol, then makes pregnenolone. Pregnenolone deficiency can cause lack of mental acuity and can elevate low-density lipoprotein, or LDL cholesterol. When your body loses the ability to convert cholesterol to pregnenolone, it keeps making cholesterol in a futile attempt to make hormones. So you end up with more and more cholesterol, something fairly typical with aging. DHEA is a hormone made from cholesterol by your adrenal glands. DHEA plays a role in the production of testosterone and estrogens. In order to optimize effective management of symptoms associated with menopause, it's important to have your DHEA levels checked, as DHEA has been shown to elevate mood. The thyroid gland is essential to the endocrine system. The thyroid gland releases T3 and T4. These hormones play an important role in regulation of your weight, energy levels, internal temperature, skin, hair, nail growth, and more. Now, many healthcare professionals typically only test for thyroid-stimulating hormone, or TSH. But TSH is a pituitary hormone and not a thyroid hormone. If your TSH is high, that means it's trying to get your body to produce more thyroid hormone. If TSH is low, that means you're producing too much thyroid hormone. We advocate for getting your thyroid tested to more accurately determine thyroid hormone levels. As you've just learned, there are many types of hormones. They all produce different levels depending on age and individual circumstances. As a result, there is no one-size-fits-all remedy. That's why it's so important to clearly understand what's specifically happening and what the right treatment path is for you. Hormone replacement therapy, or HRT, is the treatment of symptoms associated with hormone imbalance caused by menopause. By supplementing your body with the needed hormones, or balancing out the hormones and their levels, HRT extends the time period in your life at normal hormone levels. This improves the quality of your life during your menopausal years. There are two main forms of hormone replacement therapy: conventional hormone replacement therapy and bioidentical hormone replacement therapy. Conventional hormone replacement therapy is given in many forms: oral, tablets and capsules, gels or creams, patches, injectables, pellets, and vaginal suppositories. Now, regardless of form, what you are receiving are synthetic hormones. Synthetic hormones are manufactured by pharmaceutical companies and are chemically sensitized to imitate the way hormones function in the human body. You may be familiar with the brand names on the market today. The most common forms of synthetic hormones are known as conjugated equine estrogens and progestin. These are made from mixtures of urine from pregnant mares. These synthetic hormones come in standard dosages, so unfortunately, they cannot be custom formulated to your specific symptoms. This may be sufficient for some people, but for most people it simply means you're getting a lesser treatment. You're not getting the best treatment available. Bioidentical hormones are extracted from plants, typically soy or yam, and are chemically identical to those in the human body. They too can be made in many forms, including sublingual tablets. These are widely regarded as the most effective and efficient method of ingestion. Your hormone levels are different from your best friend's hormone levels. Your treatment plan should also be different. Because there are differences in the chemical structures of bioidentical and synthetic hormones, there are differing risks regarding breast cancer and cardiovascular disease. In a clinical peer-reviewed study, bioidentical progesterone did not have a negative effect on blood lipids or vasculature, as do many synthetic progestins. It also may carry less risk of breast cancer. Additionally, the study suggested that both bioidentical estrogens and progesterone reduced the risk of blood clots when compared to their non-bioidentical counterparts. In fact, the properties of bioidentical progesterone is shown to decrease the risk of stroke or heart attack. That's the exact opposite effect of their synthetic counterpart. Now, while effectiveness of therapy can be impacted by many reasons, many clinical peer-reviewed studies have found bioidentical hormone replacement therapy, or bioidentical HRT for short, to be more effective than conventional hormone replacement therapy, or conventional HRT, using synthetic hormones. In fact, one U.S.-based clinical peer review study comparing progesterone found bioidentical HRT to be more effective by double digits across all symptoms when compared to conventional HRT with MPA. And 65% of women said bioidentical hormone replacement therapy was better than conventional hormone replacement therapy with synthetic hormones. Chances are you're just seeking treatment now. You have 100 different questions to ask about what you already know, and don't even know the questions to ask about what you don't know. So for starters, here's what you can expect on your first visit. Discussion of your symptoms, including self-rating the severity of your symptoms associated with menopause. A review of your medical history and hormone testing via blood tests. Following this, your healthcare provider will develop a therapy plan. And then a specialty compounding pharmacy experienced in bioidentical hormones will consult with you and your healthcare provider to tailor the therapy specifically for you. Typically, this process repeats every 3 to 6 months to ensure your symptoms are being effectively managed and that your hormone levels continue to be optimized. If you get hot flashes, there's a good chance those will be the first to subside, followed by night sweats. After that, insomnia starts dissipating and mood swings improve. Libido is generally the last thing to improve. Now, while you have many receiving options, creams, gels, oral tablets or capsules, pellets or injectables, sublingual tablets have been shown to be the most effective way to administer hormones for consistent delivery. That's due to their very high absorption rate and the fact that they eliminate what is known as a first-pass effect. This means they are not ingested and avoid being metabolized in the liver. Additionally, sublingual tablets allow for immediate modification of your therapy in the event you're not getting effective relief of symptoms or there are unwanted side effects. Your goal is to ultimately get rid of all of your symptoms. And this is merely one of many reasons why your treatment plan should include a specialty compounding pharmacy. Compounding is the creation of a drug by a licensed pharmacist to meet the unique needs of an individual patient. A specialty compounding pharmacy is able to customize medications based upon your needs and your doctor's input or prescription. In addition to sublingual tablet delivery, which is the most effective form of medication for any HRT need, compounding pharmacists can put drugs into specially flavored liquids, topical creams, transdermal gels, suppositories, or other dosage forms suitable for a patient's unique needs. Further, a specialty compounding pharmacy possesses the technical and pharmaceutical expertise that general pharmacies just don't have. This is critically important for patients beginning nuanced treatment plans for HRT. Together with your doctor, specialty compounding pharmacies provide the triad of knowledge and medication delivery needed to effectively and efficiently begin improving your health and quality of life.